All right, welcome back, everyone. As many of you know and have experienced within the realm of rare disease, advocacy unfortunately very often falls to those affected and their loved ones. Oftentimes, this is due to a lack of awareness, capacity, and resources available to the rare disease community. Therefore, it is important to know how to advocate for yourself and for the FA community as a whole. Our next speaker is the Associate Director of Advocacy at the National Organization of Rare Disease, also known as NORD. I'm very pleased to welcome Kristen Angell. Kristen, thank you so much for being here with us. The floor is all yours.
Okay, sorry about that. My mouse froze. Hello, everybody. Thank you for having me today. I am Kristen Angell. I'm Associate Director of Advocacy here at NORD, and I'm looking forward to talking about Advocacy and Policy 101 today with you all. Let me just share my screen. Okay, so hopefully y'all can see my lovely screen. And this is a quick overview of what we're going to cover today. We're going to do, I'll introduce myself, tell you a little bit about me and my history and how long I've been at NORD. We'll do an overview of what NORD is and who we are and some of the services we provide. And then I'll talk a little bit about advocacy and the importance of it and how to become an advocate, why to become an advocate. And then I will touch lightly on our policy work. So I joined NORD in October 2014. I'm actually coming up on my 6-year anniversary. And I have always been an active rare disease advocate. My cousin, who was like my sister, who unfortunately passed away this past year, had cystic fibrosis. So my entire life revolved around understanding rare disease and understanding the limitations that rare disease patients had in terms of everything and living fulfilling lives. And prior to the Affordable Care Act, living without being able to access private insurance. I've been an advocate for rare diseases my entire life. And then obviously in my adult life, I took on a new role in advocating with policymakers and making sure that the rare disease community and other organizations I support, are advocating for change. I was a full-time caregiver to my cousin, Stacy, and until her passing. So I also have that knowledge of understanding what it's like to be caring for someone with a rare disease. I live here in Southbury, Connecticut. Our home office for NORD is based in Danbury, Connecticut. We also have a satellite office in Washington, D.C., as well as our executive team is housed in our office in Boston, Massachusetts. And I use the term our office, very loosely these days because we are all, as you can see, working from home indefinitely due to the current pandemic. So NORD is the leading organization that fights to improve rare disease patients and families' lives by supporting the patient organizations that serve these communities, as well as providing education and information and resources and driving public policy. NORD was founded by patients and caregivers in the early 80s. The Orphan Drug Act was signed into law by President Ronald Reagan in 1983 due to some group of parent advocates and small organizations in the rare disease space that knew that there was a need for rare disease research and drug development. Prior to 1983, there was almost no FDA approved treatments for rare diseases because the pharmaceutical companies were not interested in researching rare disease spaces where they're not going to have a large population of patients nor have be able to make a significant profit on their treatments. So these parents got together and formed a coalition to advocate for change and make what is now the Orphan Drug Act law that holds true till this day. The legislation provides a tax incentive for pharmaceutical companies that are researching rare diseases. It provides exclusivity for a certain amount of time once a drug does get approved, and a whole bunch of different tax incentives for the research. I know that at the time of the legislation passing up until just a couple years ago, the tax incentive was they would receive 50% reimbursement of their clinical trial costs for anything related specifically to rare disease. And that is a significant thing. A couple years ago, it was up for being repealed completely. NORD and our patient organization advocates got together and rallied and ensured and made sure that we were advocating on Capitol Hill to keep the Orphan Drug Act intact, and we still do that to this day. Unfortunately, they did lower the incentive for the clinical trials is now 25% recoup of those funds that they spend during a clinical trial process. However, it is very important to NORD. We are continuing to champion for this bill, as it does once in a while come up for a conversation about repealing it. And we're really proud of the work we've done since then. After the legislation was passed and signed into law, the parent advocates and the patient organizations behind it realized there was a need to represent the rare disease community as a whole, because these rare disease patients and communities were so siloed and very small. They realized coming together, they were a much larger voice. And that entails how NORD was formatted and born. And our founder is seen in the left photo here, seated. That's Abby Myers. She's the founder of NORD, who spearheaded the Orphan Drug Act. So NORD represents the 25 to 30 million Americans with rare diseases. Any disease or disorder or syndrome or condition that affects less than 200,000 of the US population is defined as a rare disease. There's approximately over 7,000 rare diseases, and then there is only, I think, less than 10% FDA approved treatments for rare disease, specific to a rare disease. And this is where NORD comes in. We have a majority of different areas at NORD. This is kind of a snapshot of the different areas that we focus on within our organization. So we have public policy and advocacy, which I'm going to be diving into today, so I won't really spend too much time on that specific topic. We have direct services. So we have patient assistance programs. We have clinical trial, travel assistance programs. There's an array of programs that our patient services department offers to all rare disease patients. Some are disease specific, some are drug specific, and some are just need based on financial backgrounds, underinsured or not insured. We work on capacity building with nonprofit patient organizations and helping those organizations get their name and brand out there and making sure that they're raising awareness for their specific rare diseases. We have an organizational membership platform that we work through to do the capacity building. I know the Fanconi Anemia Research Foundation is a longstanding member of NORD and work with us on everything from advocacy and policy work to, capacity building and getting a seat at the table when it comes to conversations revolving around rare disease with the government officials, the FDA, the NIH, or any other, coalition or consortium that we feel is necessary to bring to the table and have conversations. We also work in research and innovation through our research department. We have rare disease specific grants available to specific disease states that have matured funds. So if a lot of these 7,000 rare diseases do not necessarily have a patient organization behind them, unfortunately, due to those small populations. So NORD kind of takes over that role for those organizations or those groups. So if it's a small group of patients or caregivers that are specifically looking to research specific diseases, they can fundraise and create an account of sorts that can eventually mature to a certain amount of money, and then it will be released for a request for proposals worldwide to researchers and they're seed grants. So they're typically around $35,000 to $30,000. But that gets the ball rolling on specific disease state research and information. We have other organizations that are nonprofit patient organizations, but don't have the capacity themselves to disseminate research grants. So that's also where NORD fills a void, is we assist those organizations in releasing the opportunities for these grants and also monitoring the funds and helping transfer that to those researchers. Community engagement goes hand in hand with our advocacy work, but it's also, we have a Running for Rare program, we have a lot of fundraising programs, but we also just engage the community on Rare Disease Day. NORD's the official US sponsor of Rare Disease Day, which takes place on the last day of February every year. So every 4 years, it's on the rarest day of the year, which I always like to highlight. And then we do public education. So we have an online education series that comes out with monthly webinars for all of our rare disease community. They're open to the public. Some are more specific to our member organizations or nonprofit organizations, but we do have educational webinars on everything from genetic testing 101 to learning about, the patient voice and drug development. And you can always visit the rarediseases.org website to find out more about our webinar series and find previous recordings of past ones, and of course the schedule for any upcoming webinars. So the Rare Action Network, I always like to, this is what I do at NORD. I actually oversee this program. It's our grassroots advocacy network. It is volunteer run. With NORD's guidance. And I also like to give a shout out. This is my beautiful goddaughter and my cousin that I was caregiver to. They modeled for us a couple years back, and we still use their photos, which I love. So we have a volunteer state ambassador program. And what that is our volunteers represent the state in which they reside in, and they're the liaison between what's going on in the state and NORD. We have a small policy team here. It consists of about 6 individuals, and we cannot cover the entire country all at once. So we implemented this state ambassador program a few years back. And what that means is these are volunteers that go through some extensive training and are representatives of NORD when we cannot physically be in the room or at a meeting. They know how to properly represent us, and they are essentially a part of our staff, even though they are volunteers. They are more of an asset than we can ever thank them for. As you can see from this map, where there is orange is where we currently have state ambassadors or multiple state ambassadors, and where there are the white states, we are currently seeking state ambassadors. So if anybody's calling in today and interested in learning more, you can email me and I will gladly give you some information. I'll also be glad to connect you to your state's ambassador if you would like as well. We also have 16,000 members in the Rare Action Network spanning across all 50 states. So members sign up from rareaction.org, our website, and they end up getting tied into communications based on our policy efforts and our advocacy efforts, and then they get tied into their specific states, events, and activities that their ambassadors may be hosting or having. So you'll get regular communications by state, and then we also send out regular communications about the ongoings of the whole program nationwide. And that's really exciting. So I encourage you all to join the Rare Action Network by visiting the site. There are a couple of different things that we like to highlight for this program. We do have, as you see, our own website for the RAN program. We have a state action center. So in my little screenshot here, I've got Texas up, and each state has its own state page that are customizable. So we work with our volunteers to put out information on these pages of state resources, really any activities or events that are happening in the state that revolve around rare disease. And then of course our contact information for our volunteer ambassadors and our other volunteer role, which is a community engagement liaison. You can access this state action page 2 ways. You can go to the homepage on our rareaction.org and go under resources, and you can connect that way and click on your state. But you can also visit rare and your state's initials.org. So Texas, for example, is raretx.org. The only state out of all 50 states that is spelled out is Georgia. Rare GA was just not available when we bought the URLs. So all other states are just rare and your state's initials.org. We host Hill Days at the Capitol, both in the state and in DC. to talk to legislators and elected officials about any policies that are impacting the rare disease community. We also are, as I said, the host of Rare Disease Day, and our volunteer ambassadors are tasked each year with planning and executing a Rare Disease Day event revolving around their advocacy efforts. If they're working on specific legislation, they'll work to have an event at their state capitals typically. Obviously for 2021, we are going completely virtual for our events this year, and it will be a first for us, but we're really excited to kind of see how this unfolds. We're currently in the planning process of planning these state events. We will still be inviting legislators to attend and speak at them. It will just be virtual rather than in their state capitals. We work both on state and federal advocacy campaigns. We also provide training, education, and awareness resources for the rare disease community, as well as our ambassadors. The trainings, there are on-demand trainings available on our website, everything from how to tell your story to how a bill becomes a law. And that also is under the educational resources on the site. We also publish an annual rare disease state policy report. So those state URLs that I shared are the state action pages that you can access. On every page is your state's report card, and that shows some of the initiatives that NORD follows very closely and works on within the states and the federal level. And it shows a grading scale on how they do. Many states, have good areas that they're doing great in, and then other areas that they may have received an F in. Don't be discouraged if you see a lot of Fs next to your state's report card topics, because that is what these are for, is to bring them to legislators, explain to them, hey, we're doing great in this area, but we need to improve in this area. And we brought this to show. So it's a great tool when meeting with legislators to talk about rare diseases and the need for improving policy to impact the rare disease community. This is just kind of a high overview of what our policies issues focus on. We are an umbrella organization, so NORD represents all rare diseases. So you won't see us necessarily advocating for specific disease initiatives. We will support those, but we do not lead the efforts on disease-specific legislation. But what we do all have in common in the rare disease space is access to adequate coverage and affordable treatments, access to accurate diagnosis and a timely diagnosis, innovative medicines and therapies, advancing research and regulatory science. And then just recently this year, we even have been developing issues and working closely on the COVID-19 pandemic and ways to help the rare disease community navigate this new world we're all living in. We also have implemented a campaign for rare disease advisory councils around the country. A rare disease advisory council is made from the state legislative body. Typically the governor appoints these positions, and they consist of legislators along with rare disease representatives in the community. So a patient, a parent of a child with a rare disease, for example, a nurse that treats rare disease patients, a physician that specializes in rare disease, industry representatives, so that at the table they can get together and discuss any legislation that could potentially impact the rare disease community, and discuss ways to whether the council would be in favor of or opposition of a specific bill that is coming through. They would be able to advise the state legislature on the reasoning for their decision as to whether to oppose a bill or support a bill. Telehealth, as many of you may have learned over this pandemic, has been a hot topic. We've always advocated for telehealth and telemedicine, but now even more so with COVID-19, it's important that we continue that work to make sure that once this pandemic is in our rearview mirror, that telehealth does stay around. It's important, and we're seeing the positive outcomes of telehealth and people being able to keep their appointments regardless of weather conditions or traffic. And it's been very interesting to hear the positives that have come out of such a tragic time, in our country with this pandemic. And then, of course, the state report card that I mentioned, which talks, and I will dive a little into those different topics in a few slides. So these are just some quick snapshots I always like to share of our ambassadors meeting with state legislators. This was our day at the Capitol last year in Washington, D.C. After our Orphan Products and Breakthrough Summit that takes place in October each year. It will be actually being held next week in virtual form. But we go and we advocate, we talk to them about the bills and the importance of being able to consider the rare disease community when they are making decisions at the state or federal levels. And it's always, we do this also within the states at the state capitals, but these shots are actually from the Hill. One thing that the RAND program rolled out in May was we realized very quickly there was a need for discussion on the COVID pandemic and how it's actually impacting the rare disease community. So in May, we hosted our first round of virtual discussion groups with our NORD Rare Action volunteer ambassadors. They hosted these meetings and they were small, close-knit video Zoom calls where you're able to exchange your concerns about the COVID pandemic, how you've been impacted, how maybe your treatments or your access to specific things, PPE, medications have been impacted by the pandemic as well. We took a lot of this information and brought it back to the team to be able to better understand what the rare disease community is in need of now immediately through this pandemic. And we also took information from some of the positives, being what I mentioned earlier on the telehealth. That was a really important area that we want to continue to advocate for and make sure that does not go away after this pandemic is gone and that people do have access to those physicians regardless of the current situation. So after all the states that we have ambassadors in hosted these meetings, we actually decided, after listening to the rare disease community, many of these people have not been hadn't left their houses since March. So they have been very isolated, and they were just welcoming to be able to connect with other rare disease patients, regardless of their diagnosis, because they realized they had a lot of common challenges amongst each other and were able to connect and not feel so alone and isolated. So we decided to continue these virtual discussion groups for the remainder of the year. So we host, and depending on the state, we host various discussion groups either monthly or every other month. In states we don't currently have an ambassador, we just encourage people to join the neighboring states or any state really, all are welcome on these calls. And really just kind of share your thoughts, share what you'd like to see happen, and learn more about the rare disease community and connecting with others with the same struggles that you're all going through. So this is my favorite part of the presentation. This is what I love to do. I love to talk about advocacy and the importance of it. I always start with our volunteers when they first come on and explain to them, when they are starting out in a state for the first time, I said they're starting out in an empty stadium, and their job is to fill that stadium, because as much as they're cheering and screaming in that stadium while it's empty and it's just them, if you fill the stadium, you're going to be heard more. So we need patient advocates and supporters of the rare disease community to use their voice to help us advocate for change. And I've always liked this Dr. Seuss quote, so unless someone like you cares a whole awful lot, nothing is going to get better. It's not. An advocate is defined as somebody who uses their voice to raise awareness and push for change. A couple of things that people sometimes don't understand is that you do not need to have any specific experience in policy or working with legislators. Advocates are more powerful when they work together, which is why we bring the rare disease community together to advocate for some of these rare disease policies. And you yourself can weigh in on these policy matters, regardless of your understanding of how politics works and whatnot. The most important tool that you have is to utilize your story. Your personal story is what any legislator needs to hear and able to connect that legislation back to what exactly it is we're asking that day. And your story will connect that legislator, understanding that you're their constituent, you are dealing with this issue, this is why it's important, and they will actually take note of it. as I mentioned, sorry, I guess I jumped ahead on a screen. You can share your story, and the photo here is one of my favorites from an advocacy day we did. The woman in the middle with the striped shirt on, and her husband to the right, had shown up to one of our advocacy sessions. We did an advocacy 101 training in person in Texas, and she was so scared to go to the Capitol with us the next day after the training to talk to legislators. She'd never spoken to a politician in her life. She was very much just a wallflower, didn't even know she'd be able to come because she just didn't think she had it in her. Well, this shot is her after having 5 meetings with different state representatives, and she really got the knack for it. And by the end of the day, she was a pro, and I'm happy to report, is actually came on as one of our volunteer leaders for RAN over the last couple of years, due to having met her at this event and her finding her voice and being able to advocate on behalf of her son who had a rare disease, and they needed some change in Texas. And to the left of her is actually our Texas ambassador, Debbie Skolaski. Not only is advocacy about policy, it's also about raising awareness in the community. So as we all know, rare disease, unless you are connected directly to the rare disease, whether it be the Fanconi anemia or some other rare disease, only that group of individuals most likely have ever heard of this disease. So it's our job to discuss with the local community and the general public about rare diseases, share your stories, tell them what the definition of a rare disease is and how that impacts less than 200,000 of the US population. And then also making sure that you are working collectively with other organizations and coalitions to get your voice heard even louder. And I do encourage you all, I know I've said it already a couple times, but do join the Rare Action Network, because we have a lot of advocacy opportunities for you to share your story. Our ambassadors are fantastic volunteer leaders and are really, especially for Rare Disease Day, driving up some great activities for you guys to be able to submit your stories and share your stories and advocate coming into the new year. We also on our site have a great tool. If you don't know who your elected officials are, your federal and state, all you have to do is go to our site and enter your street address and zip code, and it will populate all the way from the president down to your local state district representatives and their contact information as well. And if you click on them, you can actually see their bios and their website links. So it's really easy to access, and that's how you will find your elected official. So I'm going to go into a little bit of the policy overview. As I mentioned, common challenges is what we look for when we're looking to identify policy initiatives that NORD is going to be talking about and discussing. On average, it takes about 5 to 7 years for an accurate diagnosis of rare disease, and we need to change that. So NORD has been on the forefront for many years to try and speed up the process of diagnosis in a safe and healthy way. We have a number of patients that live undiagnosed, so they're just being treated for symptoms because there's no name for their diagnosis. And we actually have programs at NORD for the undiagnosed, in connection with the Undiagnosed and Rare Disease Network organizations that are at local universities throughout the country. 90% of rare diseases don't have an FDA approved treatment. So most likely if you're connecting with somebody else with a rare disease, the chances of them having an FDA approved treatment as well as yours may be very similar. Extensive lifelong medical needs. This is a really important one. And the reason I always highlight this one over some of the others is with the new innovations in treatments and therapies, specifically gene therapies and genetic testings or different genetic ways of kind of altering the genetics in a person, we're seeing that these are new ways we're going down in innovation in rare disease treatments and research, and hopefully one day cures. The problem with that is they're very expensive to get these, and they're one-shot treatments. They're not like for example, like a chemo where you go repeatedly for a period of time, take the treatment, and then hopefully you are in remission afterwards. These are typically a one-shot deal. You get it, which makes the cost rise significantly, and patients don't necessarily have access to that. So we like to compare when talking to folks, and whether it be legislators, about making sure there's affordable access, that yes, it may be a $2 million drug. However, in the course of a lifetime with somebody with this rare disease, they're going to easily have $100 million worth of hospital stays and equipment and medical needs. And we do a lot of, and that was a very bad number, so I do apologize because I don't think it was 100 million, but you get the gist of it. So we like to kind of show that even though it is a very high price, that's the upfront cost. Whereas if a patient didn't receive this life-changing treatment, there could be much longer lifelong medical needs that can be even more expensive and more expensive. And that coincides with the high cost of treatment. Another common challenge is there's few medical experts. So for 7,000 rare diseases, not all diseases actually have a physician that specializes in that disease. And if there is a physician that specializes in that specific rare disease, they're few and far between, and they may not necessarily be in a patient's backyard. My sister has a rare blood disorder, and there's only one physician in the entire country that specializes in this disorder, based in Texas. And it was not easy for her to be able to navigate a physician in our area here in Connecticut that understood her disease, understood how to treat it. And so luckily we had a great team of physicians here working with her that was able to connect with this doctor in Texas and be able to work remotely to help with a treatment plan for her. However, not all patients are that lucky. Sometimes they have to just deal with their general primary physician or their specialist in their area, who may not have all of the information and available ready a treatment plan that they could be able to access going to an expert. So we work to try and create a connection and educate medical professionals about rare diseases through CME programs, continuing medical education. Also, we publish medical journals. On our website, we have a rare disease database, and that's probably our highest hit area on our website. The rare disease database, you can go in, I think there's over 1,300 rare disease reports on this in our system. And those reports are written by experts on that disease. They're also updated every 3 years, I believe, so that they stay current with information and any new innovations within that disease state. But the physicians use those reports a lot. They are written in layman's terms so that somebody that's newly diagnosed or wants to get more information on a specific rare disease can understand it. We do have physician guides also on specific rare diseases that dive a little more into the medical terminology and the treatments and whatnot. But these are great reports to bring, especially when you tell folks. I had a patient the other day contact and looking for information to share with their doctor because their general primary physician wasn't familiar with this rare disease, and the patient was doing the research, so we were able to provide a rare disease report and said, here, bring this to your doctor. They'll at least know who and what to look for in a treatment, and even physicians that were connected to writing that report as well, so they could reach out to them. Another big common challenge is social isolation. We learned that anybody with a rare disease can certainly feel isolated because the chances of meeting somebody else with your rare disease is very slim in most cases. So feeling that isolation and that you are alone can be really overwhelming. So mental health and understanding the aspects of what this disease can cause, not just to the patient, but even to the family, the caregivers, friends. It is definitely a social, environment. I always say, with a rare disease diagnosis, it's not just the patient that's diagnosed, it's the entire patient's network, because there will be a significant shift in what that patient is able to do and how they feel. So mental health, inclusion, and even bullying is a big part of NORD's policy initiatives, and making sure that we live in an inclusive world and understand the rare disease community and what these patients are going through. And then once again, small and scattered patient populations. There's some rare diseases that have 5 people in the entire world. There's others that maybe have 20,000 or 200,000. However, if they're all spread out, and thankfully, due to technology over this past 20 years, patients have been able to connect with each other and meet others with rare diseases due to the technology like Zoom, like we're having today and you're having at your conference, and being able to connect in that way. So there has definitely been a huge benefit to the rare disease community with platforms such as these, and also even social media. Facebook is a great area for patients to connect with other patients and have like a peer-to-peer support system. We see that a lot as well, especially for those groups that don't necessarily have an organization behind them. This is an example of just some of our federal policy work. As I mentioned, the Orphan Drug Act is our first and foremost one that we're super proud of, and we are continuing to advocate for. The Newborn Screening Saves Lives Act, as many of you may know, when a baby is born, they get tested for specific rare genetic diseases or specific genetic diseases, and NORD has been on the forefront of advocating to ensure that all of the recommended uniform screenings are listed on the state's newborn screenings website, or the testing. They're all being tested. So some states do better in newborn screening than others, and we've been advocating for many years now to enforce and make sure that all of the states are up to par with testing for all of the diseases recommended by the RUSP, as it's called, from the states, their government. Medical Nutrition Equity Act, that's we advocate to ensure medical foods are available to patients. A lot of times insurance companies will deny medical foods because they classify it as a food and a grocery and not necessarily a medicine. However, with infants, there's special formulas for certain rare diseases that the infants need to survive and thrive, where the insurance companies won't cover it. They just see it as basic formula, and that's not. So we've always been advocating to ensure that these patients have access to their medical nutrition when prescribed. And then the Affordable Care Act is, we are making sure to protect insurance and making sure that rare disease patients can continue to get coverage. Great things came out of the Affordable Care Act, but there are holes, and we do need to, improve there as well. But the best thing that, for the rare disease patients was the pre-existing condition clause had been removed, and we're ensuring that that does not get repealed at any point. I know it's been in the news recently of potentially repealing it. And so, NORD takes a lot of affirmative actions on anything having to do with making sure our patients stay being able to access their health insurance, regardless of a pre-existing condition, and telehealth. And I won't really dive into that too much more because I did already kind of cover what telehealth was, the benefits of it, but we do that on the federal level as well. Our state policy efforts consist of step therapy. So that's typically when a physician will prescribe you a medication specific maybe to your rare disease or a symptom that they know will help that disease. But in the rare disease space, typically there's only one medication for a rare disease that would work, and physicians, may get this information and know that and prescribe it. And then an insurer comes back and says, well, actually there's another drug we want you to try that's cheaper before we can try this one. So while NORD is not opposed to step therapy, we're opposed to it when it comes to rare diseases, because a lot of times some of those other generic drugs or cheaper drugs are already documented and scientifically documented that they do not work for that rare disease, and in some cases could be life-altering or life-ending if they were to take that drug. So we have been advocating to make sure that states have step therapy provisions in place, and making sure that when a prescriber prescribes a specific drug, that there is communication between the insurance company and the prescriber to understand why that drug was provided, and understanding that it is the only treatment option for that disease, and they would be able to bypass that step and being able to take the first or second drug before getting the expensive one. Capping out-of-pocket costs, as we all know, insurance can cover things, but there's always a lot that insurance does not cover, including with prescriptions. A lot of prescriptions sometimes have, a cost sharing where the insurance company will pay 75% and you're responsible for 25%. Well, with rare disease, orphan drugs, as they're referred to, those can be significant amounts of money monthly. I met a family that was forced to stop paying their mortgage payment so that their daughter could get their medication monthly. They had to pay about $2,500 a month out of pocket to be able to access their daughter's treatment for a blood disease. So that is something that we have consistently worked on in the states to ensure that there are caps. And a great example of a state that has a good one would be New York. They have a one in place for prescription drugs that you cannot pay more than $100 per medication per month for any specific drug, which is a great legislative model that we've been using in other states to compare to. Medical nutrition, it was on the federal level, and it is also decisions made on the state level as well for Medicaid and all of those, different kind of state insurance programs to make sure that medical nutrition is covered and maybe making sure that patients have access to it. And the rare disease advisory councils, which I also mentioned, those are policy efforts that we do on the state level. We currently have 14 RDACs, as I use the term for short, but there are currently, I think, 15 more states that are in the process of developing legislation or proposals to begin the process in 2021 of getting a rare disease advisory council in their state. And newborn screening is also a state-based issue as well as a federal issue. So we monitor both on the state level and the federal level for newborn screening. We have our individual state report cards that come out each year. The next one for 2020 will be released in February, I believe. But currently you can visit and see the 2019 state report card. They are snapshots in time, so they're done at the end of the year. So for the 2019 one that's out now, it was published at the end of 2018. Or 2019, sorry, and released. So you can actually, there may be some discrepancies and maybe a law passed within the last 12 months. We do not update them in real time. It would be virtually impossible to do it for all 50 states any given day. But it is a snapshot of where we were at the end of the year in terms of the grading scale. And then we'll do an updated one each year after the world. And I apologize, my cat's making an appearance on my computer. If you're interested in learning more, we have on our rarediseases.org site, so on the NORD website, there's actually a policy statements page where you can see what we've been up to, if we've sent any letters or support letters or coalitions, any kind of work we've been doing both on the federal and state level. You can see this here as well as on the RAND site. Thank you. I love our tagline, so I always like to share it. Alone we are rare, together we are strong. I do hope that you gain some knowledge of advocacy today, and I hope you do decide to become a member of the Rare Action Network in your state by visiting rareaction.org. And I'm happy to assist with any questions you may have. Anytime, feel free to reach out. Any questions?
Hey, thank you so much, Kristen. That was, to say the least, a wealth of information. And I'll just start out by asking regarding that, because there is such a diverse number of programs that are represented that you spoke of. Would they go to initially just to the NORD website? You mentioned a number of different pages. So maybe we could get a list of those again in the Slack channel, if you wouldn't mind listing those. At some point, that would be really helpful, I think.
Sure, absolutely. And I know it's a lot in our website now. And I actually, a little inside information, I believe we're merging all of our sites together at some point in the coming year. So it's not as confusing, but yes, the RAND program, anybody interested in joining RAND, please visit the rareaction.org site. And but patient assistance programs, all of NORD services and programs are based on the NORD website, the rarediseases.org. But I will certainly put them up in the Slack once we're done with the call.
Okay. Great, thank you. Regarding that, one of the initiatives that you talked about was the state ambassadorship that people can volunteer for. Do you have any idea what kind of time commitment that might represent for an individual?
Sure, great question. So we approximately 10 to 12 hours a month is that's kind of the average. In any given, I mean, we have slower times of the year, especially this year has been kind of slow because we haven't been doing much policy work or in-person events. But in a normal world where we're out in the community, we're challenging our volunteers to do specific activities and events in person. Now we're challenging them to do virtual activities, but it does take approximately 10 to 12 hours a month, give or take. Certain months, if you have an event coming up, it may take a little bit more. If you don't have any events or you're not working on any policy initiatives, then it could be a little less each month. We host RAND Leadership Training Academy series for our ambassadors and our community engagement liaisons. And those are monthly, usually an hour to 90 minutes per month is dedicated just for the trainings. The trainings are on suggested topics from our volunteers, things they'd like to learn more about. Could be something as simple as like learning about our Google Drive that we work off of, or more in depth about our policy initiatives and understanding Medicaid expansion. We develop these training programs specifically based on what the volunteers are in need of.
Okay, wonderful. Thank you. So remember that you can ask questions in the chat box, and it looks like we have one from Faith. It says, New York appeared to be covered for advocates, but would they still want or need any additional help from somebody that lives there?
Absolutely, absolutely. So what's great about our RAND program is, we had to identify kind of an initial point of contact for each state, and we're still doing that. We're in about 35 states right now. But we have RAND members across all 50 states, and there's different ways to get involved. Our New York ambassador, Mary, she's fantastic. And we have two community engagement liaisons also. One's located in New York City. She's just coming on board, and one is in, I believe, the Hudson Valley area. And what's great is they're going to be doing more localized events and activities in their areas. So our goal is to really get coverage across these states. And there are volunteer leadership roles, regardless if there is an ambassador in place. If it's something you still want to volunteer for, the community engagement liaison role is really a good step. For New York, I think we're okay with CELs right now. However, they're going to be looking for people to join planning committees for activities, people to share their stories, with legislators, or maybe be featured on their website, on the state pages or their Facebook pages, because each state has their own Facebook page, most of them. It's up to the volunteers if they want to manage a state Facebook page. But New York does. So New York is one of the states that does have it. And I definitely encourage you to reach out. If you go to rareny.org, you can get the contact information from Mary and Jessica, and then our newly appointed one, her info will be up next week, and see how you can volunteer and get involved.
Okay. Great, thank you. And thank you, Faith, for that question. So any other questions coming up? Let's see. Oh, Faith said thank you. She's the one that asked the question. So let's see. I do have another one that was presented to me, and I haven't had a chance to really look closely at it, so I'm just going to read it. Sometimes it feels like there's so much work to be done that it can be overwhelming. Where is the best place to start if you're curious about how to get involved in advocacy? Would it be the Rare Advocacy Network, or which one of the resources that you gave?
Yep, it would be the Rare Action Network, most certainly. Since I oversee this program, I mean, if you were to email our general inbox, it would actually come to my email. So you guys are lucky you have my email right in front of you. You can always email me directly, and we can always set up a time to talk. One of the things I would recommend visiting the rareaction.org site is that resource center with educational videos. They have like on demand, none of them are more than 10 or 15-minute presentations. And there are different ones on how to share your story. That's probably your most important tool and resource that you are going to be able to bring to the table is your story. And there are ways to tell it the right way, and then there's ways to tell it where it may just be a little too much information needed for a specific reason. So if you're meeting with a legislator, they don't necessarily need to know every doctor's appointment you've ever had to get a diagnosis, because you'll be there all day and they don't have all day. So we kind of help you craft your story to be able to get your point across, get your story across, but in a timely manner. So I would definitely suggest, if you're just starting out in advocacy, feel free to contact me, but also, or your state ambassador as well. They can walk you through this as well. But also check out the how to tell your patient story. I always suggest people to write it out so you have it in writing, and then also create that into a spiel, a speech, and then also create it into a 15 or 30-second elevator pitch, which is really challenging, and that's always a fun activity to practice.
Yeah, but such an important one. You never know who you're going to run into, tell your story to, in a really even just a short way like that, and it can be quite impactful. So that's a great idea. Thank you. We have a question from Jack. He says, "Hi, Kristen. Are there any upcoming national virtual advocacy events for the remainder of 2020? And a side note, he just recently joined the Rare Action Network in Illinois." Yay. Thank you, Jack.
Yes, thank you, Jack, for joining. And Maria is our state ambassador in Illinois, and she's wonderful as well. She's a cystic fibrosis patient. And she's also the chair of the Rare Disease Advisory Commission in Illinois as well. So she's a great contact and resource to have. Yes, there are actually virtual rare discussion groups, and I'm not sure if you had signed up recently for the one that unfortunately had to be canceled. I think it was last week that we were planning, but we are doing virtual rare discussion groups in the various states, and there are ones being planned in Illinois for the remainder of this year. And like I mentioned earlier, if your state is not having one, you can find these events on the landing page of rareaction.org. It'll say virtual discussion groups right front and center, and you just click on it and it'll list out all of the states that are having upcoming ones, and you can register for them.
Okay, great, thank you. Another question, how does one register for Advocacy 101 training, and can anybody take this course?
Sure. So we, up until this COVID pandemic, I like, so it's like before and after, and I'm sure we can all relate to this, but prior to COVID, we were traveling across. One of my parts of my position is to travel around the country and host these Advocacy 101 workshops, similar to what you were presented on today. However, we don't currently right now have any Advocacy 101 webinars planned for 2020, but it is on our docket for 2021 to host an Advocacy 101 for, I don't know if we're going to do regional. I think we might split up and do a couple in different time zones so that people are able to access it. So I would definitely, become a member, and then you'll get communicated when those happen. And like I said, the on-demand videos also have a lot of Advocacy 101 tips and tricks and understanding of advocacy.
Okay, great, thank you. Another question is, I'd like to address this actually to our community, to the FA adults out there. Just wondering, what are some of the barriers that you've experienced if you've thought about advocacy, and what you what you feel you would need the most help with, and where could Kristen maybe point you in the direction of? So if we could have some of our adults, or even parents, caretakers, loved ones of adults with FA, if you've had any barriers that have kept you from advocacy, that would be great to bring up now and see if we could get some answers for that. Yeah, I know that in my position, I've used NORD quite a bit for your resources. It's a wealth of information. The webinars are great. They're easy to access. There's a lot on the site, but it's just so very helpful.
Great.
So really appreciate all of you so much. Anybody want to discuss what your barriers to advocacy have been? Or maybe if you need more clarification on exactly what advocacy is. There was so much to your presentation today, sometimes just getting it down to the bare nuts and bolts.
So, I can kind of just give, so being an advocate is not just like NORD focuses on the policy work and raising awareness, but being an advocate, being your own advocate, also involves your conversations with your family, your friends, your doctors, being able to explain your rare disease and get an understanding from others so that others can understand what you are dealing with personally. whether it be with your physicians. I know in the rare disease world, and I'm not overly familiar with your necessary specific struggles with your physicians, but I know a lot of times doctors that aren't familiar with the rare disease, and you have to go to them for something relating to your rare disease, but whether it's a gastrointestinal issue, and you have to go to a gastroenterologist, that individual may not understand the rare disease and understand that there's certain things you can't do for a standard treatment that would normally a normal patient would be able to come in. And so there's ways to, like, a lot of the advocacy trainings and stuff is also utilized for that as well, how to relay your message to your physicians or your family members or your friends to understand your position, understand what you have, understand what you're going through, so that they can be better support system for you, whether it be for your treatments and in with your medical professionals, or just in general with your family and friends to understand, because I know sometimes that can be a big challenge as well, is getting your family and friends to understand exactly what it is you're going through. But being able to share the highlights and do that like elevator pitch and have a pitch ready will really help you develop that skill and being able to be your own advocate regardless of the situation.
Absolutely. So true. It looks like we have another question. As far as self-advocacy, this is a comment from one of our adults. It is difficult to get doctors and office, maybe other staff to really listen often, and it can be very frustrating. So maybe having that shorter, condensed speech, so to speak, explaining what your disease or exactly what your need is. But yes, sometimes things are so rushed, and it is hard to get people to understand.
It is. And I would also recommend, we not that we can, provide medical advice, but I would recommend, if you're going to your doctors and you're going to have a struggle explaining your rare disease and everything, consider either visiting the NORD site to print out a rare disease report, or visiting, the foundation, the Fanconi Anemia Foundation's website for maybe some one-pagers on the disease, so that the physician has something in front of them that they can reference. That's always very helpful. And keep a binder. And one thing that I've always thought, being a great self-patient advocate, is that there's patients that get copies of everything. They go to 12 different doctors. So, they make it their responsibility to get copies of any scans, any blood work, anything. And they stay on top of it and say, I need copies of this as soon as the results are in. I need it for my files. That way, when you go to a new physician or new medical professional, you can literally pull out your book and let them filter through what information they would like. But it's always good to have kind of a one-page document on the disease state, and so that they can get at least a quick understanding of it in the short time that you do have with a doctor.
Great advice. Okay, we have one last question before we go on to our next, have a little break, let's see, or go on to our next subject. This gal, Natalie, says, I have found that my OBGYN, who is a male, has brushed me off for concerns, and I want to she went to another doctor for something different, and they listened, and now I'm having other treatments done. You have to be willing to speak up or find someone who will listen. Yeah, and if one doc isn't working, do your best to get to somebody else, I think, is sage advice.
That is great advice. And there's always different personalities. We all know that. Every person and human in the world has a different personality, and same with doctors. Some are just very narrow focused, unfortunately, and don't want to be taught something by their patient. And then you will find other doctors that are eager to listen and learn from their patient and say, okay, we're going to work this together. We're going to figure this out together. And that's great advice. It's just, keep going until you get somebody to listen to you.
Yeah, absolutely. And one last comment, I have found that some doctors view me as aggressive and annoying when I advocate for myself. And I think that goes back to that adage of the squeaky wheel gets the grease. Sometimes we have to be that annoying person to get what we need.
You do. And unfortunately, it comes with the territory, but, stand your ground. It's always stand for what you believe in, regardless of what others think. I mean, that's just a general life quote there, but, it holds true in this patient self-advocacy world.
Yeah, definitely. Okay, I'm going to do one last one. There's a comment that it would be awesome to have something written to help with conveying the psychological mindset of a person that sees 25 doctors and has constant procedures, etc. Yeah, definitely. That's a big one. So yeah, that would be something to maybe discuss on Slack. And remember that we can go on to Slack and you can continue the conversation. I'm sure there's much more that's going to come up over the next couple days. So feel free to go there. And we really appreciate your time, Kristen. Thank you so much for being here. And hopefully you'll hear from some of our adults over at NORD.
Absolutely. And thank you for having me, and great questions. Thanks. Have a great day. Enjoy the rest of your conference.
Thank you.